Well, welcome everybody. It's really good to see you, and I realize there's another whole page of you too, depending on how you've got your computer set up, and the chat line is also open if you want to click on the chat, just in case you wanted to, during the conversation, wanted to make a note or leave a note. The big question for us this morning is thinking about reopening, re-entry, whatever we want to call it. Is the restrictions being eased in terms of people being able to go back to work, do all sorts of things together, and that means, you know, when do we as a community want to sort of open the church? How do we want to gather? My sense of it is that we're certainly not going to be able to just, we're closed at least, and I say at least until the end of May, but like on June the 7th, for example, I don't imagine that we're all going to be in church like we used to be, and that there will be still some restrictions, and not just simply restrictions imposed upon us by government and health departments and what have you, but I'm also thinking, and more importantly, I think, is really about what do we as a community need in order to feel safe to do what it is that we want to do. And one of the things that I've done is ask Kelly to head up a group. I know Catherine's been invited, there's several others. We've got a couple of doctors, other people in the congregation to put together a plan. And at the moment, we don't really know the timeline. But what I'd really like today is just to have a sense of where people are. I've been asking the question, are you ready to come back to church? And lots of people have been saying no. That's been some of the folks who are in the older category are saying no. You know, I'm in one of the high risk groups, or we're in the high risk group, and we're not ready. And I've also had young families say, we're not ready. I've got a son who puts everything in his mouth. And we're not ready to, well, I'm not ready to sort of be back out in public where I'm having to police everything that goes anywhere near him in that sense. So it's probably going to be the end of the summer before they as a family feel safe to be sort of wandering in the community or engaging with the wider community in things like church worship. And so one of the things that we've talked about as a staff and is that we will continue to do the children's chapel. Some of you probably saw a little bit of it this morning as you were tuning in. We'll continue to do children's chapel by Zoom all the way through summer as a way to connect with the kids and young families and what have you. And that service I find quite delightful. It's fun, and so we'll continue to do that at least all the way through September, and then we'll see what we'll do. But that will be one thing. So what I'd like to do is just to throw the conversation open and just where are people at? And a big piece of it is, are you ready to return to worship? Well, actually, not only worship, but gathering. That's the thing. And what do we need to do to make it safe for you to gather?
Good morning, Nikki.
Hi, I just one aspect. Since I've been doing this service online, I have been singing my heart out with the hymns because nobody can hear me. I cannot keep a tune to save my life, which is one thing that I like about St. Peter's, the choir. Well, if I can't sing at all, I can sing even less with a mask on. How are we going to get over that aspect?
The only thing that I've read articles about the scientific effect of how singers are like super spreaders, how singing spreads the virus more efficiently than any other possible medium. And the only way that I can think of for us to be safe with singers is for us to be outdoors.
I agree. I think the priest in Rolla, who's also a doctor, wrote a blog in the iSeek, if everybody saw that. And she said the studies are showing that singers can project either aerosol or droplets up to 27 feet. The louder you sing and the more forced you sing, the further it goes.
Therefore, you need a mask.
A mask or, right. Or, you know, I don't know whether you put them up in the balcony, in the back of the balcony, and nobody else is up in the balcony, and, you know, I don't know.
The only problem with putting them in the balcony would be that they would spray out over the entire congregation.
Well,
so.
I was thinking like a I'm sorry, I was thinking like a quartet, and yeah, I think you'd have to put some kind of screen up.
The scenario that I came up with when we were brainstorming last night, my husband and I, is that if we closed off that front circle drive and had like the choir up on the porch steps and everybody else out in like lawn chairs on the asphalt and the grass, that might work.
Is the choir then in danger of infecting each other then, though?
Yeah, that's the problem.
Yeah, well, I'm pretty sure I've already had it. I had it in March.
Oh, Roberta.
Yeah, because I even got the COVID toes about a week later. So I'm like, okay, I guess that was. But I only had the mild form, nothing to worry about.
This is Jeannie, and am I on?
Go ahead, Jeannie. Yep.
Yes. I can't. Okay, thank you. I thought I would tell you about our vestry meeting this past week. We had everyone in attendance except for Julie Peters, who gave birth that morning to a baby boy. So Walter Peters came into the world. Every single vestry member is hesitant and really taking this cautiously and seriously about reopening, starting with the comfort of our clergy, all the way through all the things you're even mentioning. And when we all love the music so much, when we do come back, it's going to have to be a smaller group of singers who can totally social distance. And it's just very hard to think of them wearing masks. So, you know, and projecting and singing in the way we're used to hearing. There's so many details like that, and I'm honored to be on Kelly's committee. And I think we are going to take our time and be very cautious in our plan to gradually reopen. And I'd just like to thank all of you who have participated in our Sunday services. They're just so outstanding. And right now, that's our bridge. We think that it's done so well that it's more uplifting to see what we're seeing now online, the way we're doing it, than to see, you know, us in masks way apart, not being able to see a smile, hear our full choir. So just know that this is going to be a very carefully thought out process. And if you have any specific comments for the vestry, please email me or call me. And now I look forward to listening.
Will there at least be organ music? When we do reopen it?
Yes.
Let me just say a couple of things about the reopening, because I think we're not obviously going to go back immediately to the way it was. That's clearly not possible. And that we'll probably have 3 or 4 phases of progression which will be dependent on some really good health data in terms of what is going on. And that's part of what we're doing, is setting up those criteria as to when we'll be able to do it. Singing, which as many of you have said, music is one of the core characteristics and charisms of St. Peter's. And clearly we will not be singing like we have in the past. Obviously organ music would be fine. And even if we were doing social distancing and those kinds of things, at least for the first month, I doubt that there would be any singing. The other piece of this is that, and this is one of the issues, is we will be, whatever we do within the church, we will be streaming that, so that for those who don't feel comfortable coming back immediately, if we are in the church doing a service, that will be streamed so that people can participate online, very similar to what we're doing. The other piece of this, and this is where it, in terms of just getting some feedback from you, is that it may be better, whatever better actually means, to continue to do what we're doing, to allow the music and the hymns, and as several of you have said, and to actually continue to stream the service from our home rather than have half a dozen people in church just saying a service. And at some point we need to ask ourselves, you know, if we have a couple of dozen people in church and they're all masked up and we're not doing communion at that point, and that, because that would be another phase down the road, is that actually better than doing what we're currently doing, and including music and all the things that we're doing? And so those are some of the questions that we are wrestling with in terms of trying to figure it out. I've been really impressed with the worship services that we've been able to put together, and to all the people who have contribute to those. I am just incredibly grateful to be part of that team. And I do strongly wonder and think, well, I think that would be, what we're doing is better than maybe having a few people in church doing a very limited service because we can't use music and other things. So these are all the possibilities that we're looking at and establishing criteria for, in terms of how do we go forward. As I said, and this is just even something, you know, would streaming a service from within the church with a dozen people in the church, all wearing masks, not having communion, be as edifying and uplifting as what we're currently doing?
Did I say
Catherine.
something? It's Dudley. One of the things I think we ought to consider is, how do we let the whole parish know that we're in business? I think people have seen it sort of like summer vacation. They've got a good excuse not to come or not to participate or not to listen in or something, and wondered if when the staff goes back, that people say, you know, or if they don't go back, letting everybody know that the staff is working and available and how to reach them. And then two is that if we continue the online thing or the children's service, that we really reach out and call people, contact people personally and say, come join us. This is how you do it. Maybe there's a training session, but to say to, you know, churches at 8 o'clock or whatever we're doing, children's services at whatever time, and say, will you join us? I'll meet you there online, because I think people are sort of drifting away or waiting around. And as long as it looks like there's no immediate conclusion to this, 2 years or so, that we really need to think of long term, but how we really let people know that the church is in business.
This is Catherine. If you don't mind, I wanted to build on what Nikki said and what Dudley just said. So what I appreciated hearing from Nikki, I do think there are some blessings about the way we've been doing things for some people, and I think it may be helpful to name those. There are ways in which my experience, there are things I don't like about Zoom, but there are other things about this time that have opened up a new way of worship and connection for me. And then to Dudley's point, I do think there are people who maybe it is like summer vacation, But it also may be, I know one person that I've been in touch with who just doesn't have a computer. And so really being intentional and mindful about who cannot benefit from the current structure and what we can do there.
That's a good.
Just to let you know that there were 63 people tuned in this morning to our worship. And during the course of the day, if anything, in terms of previous weeks, by the end of Sunday, about 200 people will have connected. And
Wow.
so that people are connecting. It is kind of weird when you're in your own house and what have you, but there are people connecting to the service based. The other piece of that, I think communication is really important, and we'll continue now. So Jane, you had a comment as well.
Well, I think, and the number surprises me. I know for me, and I'm, gadfly social person, but I really have enjoyed, I don't watch it till Sunday afternoon just because I like to sleep in. But for me, it's been nice to watch it when I'm ready for it and when I can be truly present. And I think I get a lot more out of it. And if there's a part I don't like, if it's a hymn I don't like, I push on the scroll bar and move forward. I didn't say that out loud, did I? But there is something about that. And Dudley, to your comment, we do have phone trees going on currently to keep in touch with parishioners. So I think to continue that and let them know what's going on is a good idea, and continuing contacting people that way. I know I call a couple people every week that I've been assigned to, so I agree with that. I think personally we are not ready for corporate worship on a regular Sunday. I think, what does open mean for us? Do we offer simple prayer service with only organ music for those who physically feel the need to be in church and with masks, and that isn't recorded, but that is just that live experience for those who really feel like they need to? And I think, I know the Catholic Church, most churches are doing a reservation system now, which I think is the easiest way to control your size, that if you want to come to church, you have to make a reservation. And when it gets to the specified number, whatever it's going to be, 25, I don't know what our physical distancing will be, then based on that, how many services need to be. But I think maybe we crawl before we walk, before we run. So maybe that's continuing the big full video service at live or at our leisure, and then maybe that. I think that maybe in a couple of weeks we can begin, or sometime in June I should say, we could begin to offer a simple prayer service without communion.
One important
morning
thing,
prayer.
well, one important thing that was said a little bit ago, and I would like to emphasize, is that I think we really do need, for the people that this ministry is not currently reaching because they're techno-challenged, I really think that it would be very helpful to have some kind of training that for people to get on Zoom and online, because just from the Guild Zoom meetings, it's very hard to communicate to people which button to push and how they need to look for it. So if there could be some kind of training for that, I think that would be extremely helpful.
Yeah, we need a geek guild.
Hey guys, this is Carrie. Can you hear me? We're not sure if, okay, good. I just want to touch on what Jane was saying and others. I agree that the service, we've been able to replicate all of the aspects of service nicely. But I am sure that you feel the same. I still miss the physical space of the church. Of course, there are so many safety issues to consider, but I do wonder if we could, permit a small, very, very distanced group, to begin worship sometime during the summer months. You can sign up once every 3 months or whatever it is, but just to be able to be in the space. I just desperately miss the building.
I miss the sense of community, which I think St. Peter's really, we all enjoy that, the coffee afterwards, and And this forum is right now giving me a real sense of community, seeing everybody and having this open discussion. And I would be reluctant to open the church for a lot of reasons, but one of which would be kind of splitting the parish between those who are showing up with their masks and socially distancing, and then the rest of us who are continuing to meet on Zoom. I think the church has done a wonderful job with the services that we see now on YouTube. And maybe I think the Rector's Forum is a good opportunity for us to experience the community of St. Peter's if it were more open and there was more discussion among us where we were able to bring more people into the discussion.
Can I say something? This is Cindy. I raised my hand in the thing, but it didn't do anything. Is it all right?
Go, Cindy.
Okay, thanks. I wasn't even sure it was working. So I love, first of all, seeing everyone, and I think everybody has great ideas and comments. And the only one that I wanted to add is that I love the idea of a small reservation-oriented group being able to go to church, people who know where to sit, how to social distance, and maybe there can only be a dozen people. That would be wonderful. So Carrie, I love that idea. But the other thing I wanted to just mention, for those of us who have children who are graduating, my daughter graduates from medical school on Monday, and she's devastated not to be able to be with all of her friends. And I think it's so clever what they've done is that everybody can watch it on the YouTube channel, and it's not secure. Anybody who can see the YouTube channel on the website can go, which is, I think, something we might want to consider. But anyone who wants to have a private experience, they've divided their class for the last 4 years into groups anyway. So we could have an 8 o'clock group, a 10:30 group. Jane, I totally relate to loving being able to sleep in a group that watches at 5, but just maybe 3 or 4 times when, if you choose, instead of going through a YouTube channel, you could go through a Zoom channel. And so you could actually be with other parishioners on Zoom experiencing the service. And that's what they've done for their graduation. And I just learned this yesterday, or I would have suggested it earlier, but I do think it's a great way for whatever period of time we continue to have to do this virtually, to kind of give people a sense of community. I also think that there, and I've probably fallen down on the job here, I used to be in charge of the dinners that we had in each other's homes. And I think that, that's another way that I can, if it's, I'm going to talk to Jeannie whenever I can, and I'll give some other ideas I have too. But, anything we can do to create a sense of community, I think is essential. I also have a father who's at the Gatesworth, so he has no cell phone. He has no computer. He has no desire to get one for whatever reason. And, I think we continue to have to struggle with the people who aren't technologically able or willing. And I think those ideas were great too, to the extent people want to be connected. What they do at the Gatesworth is they have somebody who literally in mask and gloves helps them get on a borrowed iPad, and they can listen to whatever the Zoom call is, the service is, he's going to watch my daughter's graduation over it. So just lots and lots of ideas of how we can create what we're missing. And I think what we're missing is intimacy. And I think there are ways to create it. And I think when we do it in person, we have to be extremely careful, but there are ways to do it there too. So I'll go back on mute. Great to see everybody.
Hello, this is Francis. May I say something? Could we not, can you hear me?
Yes.
Yes.
Yes. Would it not be possible to have a service like the 8 o'clock service once a month maybe? That gives people the chance to be together with the organ, not with the choir necessarily, but it gives people the chance to be in our building that we cherish and to be together. Also, I am with St. Peter's Cares in many of our parishioners. They are using Zoom. The elderly population is using Zoom. They are very grateful for the caring circles. So there are ways to communicate that we've been doing that have been successful. And we certainly can add on to those. Thanks.
In the realm of just so you know, there are a tremendous number of resources for various dioceses, including the Diocese of Missouri, about resuming worship. I'm sure our little committee has looked at it, but my personal view of the world is that there's a significant portion of our church population that is not in a high-risk category. There's a significant portion of the population that is in a high-risk category. I don't see why we can't do some sort of hybrid where if people do want to show up at church, there are some fundamental precautions. I mean, some of the things are just a matter of taking the hymnals and prayer books out of the pews. I was just looking at the Diocese of Ohio's website. There's a lot of chatter among the Episcopal chancellors about this. And so last night I was inundated with a number of different policies that various dioceses are implementing, but keeping the numbers down within the church service, keeping people properly spread, having the clergy dismiss people at the end of service in an orderly fashion. There are some fundamental things we can do that will keep people basically safe. And I don't see why we can't continue to stream those services to the extent there are people who are at this point reluctant to show up at church. But like I said, there are a lot of resources out there within our diocese and within other dioceses that I'm happy to make available to whomever if you don't want to track them down yourself.
Thanks, Al.
This is Mike Newport. I think obviously we have to be cautious, and everybody has spoken to that. But I think we also have to open up at some point. And I'm wondering, I think many people will not be coming just because they have personal health concerns or health issues. And I'm wondering if the amount of people that actually show up on Sunday is going to be a problem. And if we can do a reservation system, that's great. I don't know that Episcopalians are quite as orderly as Catholics, but you know, at some point, and we're not talking June 7th, but at some point, I think we need to open up. And like Rob says, we're going to have a system, and it's going to be we're going to build up to, you know, hopefully getting back to normal months down the line. But I think we need to open up just to show we're in business, that we're active in the community, and we're going to continue. I think the online service is going to continue even when we're back to a normal in church. So this online thing has been fabulous, but my vote is we need to think about transition, which of course Rob and Kelly and Joseph are doing, and this committee's going to do. But we do need to open up at some point, and sometime in June makes sense to me. But that's just one person's viewpoint.
Hi, it's Laura. So I like this idea too of having an in-person option as well as the online version. I just wonder if that's possible. It just seems like that's a lot of work and strain on the clergy and the staff to pull off that number of, that many services. Is it possible to do multiple in-person services as well as the online virtual service?
Could we just stream the regular service?
Well, I think that's one of the things, Brian and others, that one of the blessings that's come out of this is that we have obviously developed our capability, and that services will be streamed. And I know from what I understand, St. Peter's has a fairly big population who are traveling often, or they winter somewhere, or they summer somewhere else, and what have you. And we now have the capability to be able to stream those services, and so that will happen, I think, going forward. Even if we were back to the way we were, those services will be streamed, and we have that capability and putting that capability into practice. I think it is, in some ways, streaming, once we have that capacity developed, it would be possible to stream the services. And also, I don't see it as a major challenge to have 3 or 4 small services on a Sunday. We have 3 clergy. We don't have to have every clergy at every service. There's a way to do what we need to do, and we can also stream those. It's interesting to me that streaming the services the way we're currently doing them is actually a lot more time consuming than what we used to do, or at least that's my experience as a priest, that it's taking more time to do what we are doing. Just me personally, I know we also have lots of other staff, Jacqueline particularly, and David in the music, that there's putting all of that together is quite time consuming. So that's an adjustment, but I think that it's possible to do both.
This is Clark. We all know we have 2 or 3 professional musicians with us this morning, and I'm just curious, not to put you all on the spot, Amanda, Brian, others.
Laura,
what are you hearing from other musicians and groups about what's possible? The music is such a key attribute of St. Peter's and the experience for all of us. I'm just curious what you all are hearing.
This is Amanda. I've not heard anything good. The studies that are coming out, like Roberta said about the super spreaders, that public singing is not going to look the same anytime soon. And we just really have to keep ourselves safe. And we also want to keep everybody in the congregation safe.
Yeah, I don't think singing, ensemble singing is going to be possible in churches, in other cultural organizations, concerts, etc. I don't think we're looking at ensemble singing for another year, quite honestly, just given all the research that's out. As Roberta said, Amanda has said, it's this hyper spreading situation with singing. And it's been well documented. There's, a tragedy that many of you are aware of with a choir that continued to sing in Washington State. And it's just, the act of breathing together, of the inevitable secretions that you're spreading when you're singing. It's not going to be possible. It's not going to be possible to sing for quite some time.
I'm in a Broadway group and basically the Broadway Theater has come out and said they will not return to musicals at all in 2020. There'll be no, the only productions they will probably live stream, and it will be with just a handful of actors, but they will not be any musicals for that reason.
Pat Partridge at the Cathedral is hoping to use an octet in the choir loft. He thinks he has enough space in the choir room to safely rehearse, and he thinks 8 singers properly spread can do it in the choir loft. We'll see. That's what he's hoping for.
Hi, this is Jeff. A quick 2 cents of mine. I think the cup is half full. I went to the vestry earlier in Reverend Luke. I would think that a couple of soloists singing some Southern gospel hymns would be very elegant, and maybe a trumpet or some instrument accompanying them, even a guitar. Just two is the spiritual gospel hymns. We have a great American legacy of. So that's my 2 cents. Not saying the octet's not great, but I think this would be a great opportunity to have soloists.
I would like to add something about, we talk about streaming the service, and I think the church has really done a wonderful job of creating the service as it is now, with the music and the pictures of the parishioners and the pictures of the church. When I picture streaming a live service, I picture one camera in the balcony, poor sound quality. It would be boring, frankly, watching a big empty church with few people, some readings from a distance, and it's just not going to be the same, in my opinion, unless there is some other plan to make it more interesting.
I know that the new process is a lot more difficult and time consuming, but it also has made it so much more personal. And I feel like I'm part of St. Peter's when I'm watching these services versus the ones that you guys did the first couple of weeks that just seemed very cold. And then Cindy mentioned something that I think would be good while the building is still shut down, having some kind of watch party so people can be part of the service together. And I think you could do that on Zoom if somebody shares their screen and plays the service, so that there could be that interaction during the service for the people who want that.
Can I just say that Rob Hooman keeps coming in but never gets a chance to talk. So how does that work? I mean, I keep seeing Rob coming up, but he never is allowed to say anything. So how do you work that?
Rob, are you out there?
I guess the key to that is you have to get your thoughts in order so that you can say them, right?
Yeah. So there's a problem at his end. Okay, that's fine.
Indeed. So thank you, Vicki. I just wanted to get a straw poll of how many people on the phone have been tested for COVID. And I'm just wondering if there's a ministry opportunity here as a church to be a testing center for our community and try to start taking some of the guesswork out of this.
As long as you have a test that's accurate. Some of them are not accurate.
Well, we have lots of doctors out in our environment, and we have lots of people that are tied to the medical community, and we have a lot of people who are very uncertain as to what the future holds. And I saw a comment earlier, yay science, and I'm just wondering if we couldn't apply some here. And
except that if you get tested, a day later you might be infected again.
And just a comment, there is a lot of debate about the false negative rates with the Abbott test. There's also uncertainty if I've had it once and I have antibodies, how well I'm protected going forward. So we're still in a very uncertain place there. And even as someone who's still seeing patients, and Bailey was really sick in March, I mean, I'm going to reach out again soon about antibody testing, but I hadn't been able to get tested before.
I was tested because my daughter-in-law had it, and this was in early March. And it took 10 days to get the results, which were negative for me. But I had recorded that service with Rob, all of our clergy, Kelly, Joseph. So, Catherine, you're the best to speak that I know of right now among us on testing being a doctor.
Well, I know one of our other physicians on the group, he emailed yesterday, I think, that he's on the St. Luke's team, and I don't know if he's on the call today. There's just a lot of debate and uncertainty right now. Obviously, Abbott wants to hold by the effectiveness of their test, and I haven't looked at the original studies or the design that called into question that there may be as high as a 50% false negative rate. But we're in what I've been calling calling the ongoing uncertainty phase.
Catherine, it's Father
I
Joseph.
was,
Did you say that you haven't been able to get a test?
So in March, when Bailey was really sick, he didn't meet criteria for testing. We've been currently told at my organization that if we want testing, we have to go through our own primary care physicians. I am directly in touch, or, I asked another question recently with the head of employee health. So I was going to give him a week or two because he just stopped working 12 hours a day, 7 days a week. So I was going to reach out in early June to see if I could arrange to have antibody testing through my employment. Again, though, it raises the question, if I had it before, or if Bailey had it and I was asymptomatic, does that guarantee that I'm not susceptible if I have antibodies? And we're still uncertain about that.
This is Jeff again. The bigger question is, there are a few super carriers who show no symptoms and they could still be infected and spread to others. And a recent medical study was that a very loud person in a social gathering like a bar spreads out corona germs that hover in the air for 8 minutes. So I know none of us probably go to a bar and get loud, but all it takes is a I don't want to pick on millennials. Let's say a post-millennial goes to a bar and is rowdy on a Saturday. They could come home and infect their grandmother or grandfather, etc.
I was tested this week, and it was, can you all hear me?
Yes.
Anyway, I was tested this week, and it was really interesting to me how smooth it went. When I called and you punch a button, do you have COVID symptoms? And someone talked to me and set an appointment, and I drove down by Barnes, had the test, and the results came back yesterday. They came back negative. But what everybody's kind of said is, I've been told that there's really a high chance that the test, isn't accurate, and they go by the symptoms, and the symptoms recycle in and out. So you can feel fine, and then another day you're not. So it's just a true unknown journey that we have to kind of work our way through it in the best way we can for safety.
If we have questions about the test, I think the person to ask would be Clay Dunnigan, because he's the VP for clinical services at BJC, and he's an infectious disease specialist. So I think he's the one to ask.
And a member of St. Peter's.
Somebody mentioned a minute ago that there are different populations in the world and at St. Peter's, and we've just driven home from Key West all the way across the country, and we were at Seaside, Florida, staying at a home that had been closed for a month as our stopping point, and nobody there was wearing masks, nobody. So and they were all young, all the kids, the families and stuff like that. So they're different, I think most of the people, at least I can see on my screen, are in the close to endangered group, if not actually. And so maybe there are two groups that we're going to try and serve. Maybe the younger people may feel more comfortable because they feel they'll get a milder case. And so maybe we look at two options, some for those of us who might worry and some of us who might not worry.
The only problem with two options that I see, and I think several people have mentioned this before, is that there's a way in which what we're doing has been enormously successful and has really made everyone feel good. And if, first of all, the young are just as susceptible, by the way, as the elderly, but or as the older, I should say. Obviously, the elderly are more susceptible to the bad complications. But I just would hate to see us divide. I would hate to see us divide for two reasons. One is I feel that it would be too easy to feel that, well, those people can go and I can't, number one. And so then I would lose interest because I'm not part of that crowd. And number two, as Charlie mentioned, I feel that streaming a live service has so many technological challenges that I can't imagine it coming off in a way that is going to appeal to those people who want to watch it streamed. It would be nearly, what we're doing now is so well done, and I can't imagine doing that. You know, there are opportunities for singers to sing and soloists to sing, and there are opportunities for us to sing along and all those things, but trying to film an in-person service and then stream it would be, I think, unsatisfying.
This is Paige. I will just say that I'm really impressed with what you've done with the services and having various folks either do the lesson, or today my daughter did the sermon, or you know, the psalm, or whatever it is, but seeing those different faces and in their homes and with their children is amazing. And so, you know, let's not lose that thread too. I know, I can imagine it's a lot of work, but very, very well done. And I think is really the best of St. Peter's. I mean, I feel so positive about that.
So what would be the next step then? I mean, we've come up with a number of different ideas, and will these be taken to the committee, Kelly, that you've assembled?
Yeah, and I'll say that the committee is Jeannie Davis, Mike Newport, Brig Bittner, Sarah Falk, and Catherine Matthews, and Catherine on a more part-time basis. So yeah, we will take all of this and look toward, I think one of our primary responsibilities is looking towards, when we do open, how to do that in a way that is as safe as we can be without totally losing the purposes and the goals of worship. I'm intrigued by the idea of doing both, of keeping the online service the way we have it, and offering very small, simple prayer services that would not be streamed, for folks who long for that sense of community within the physical structure of St. Peter's. But yeah, we will be looking at how to return safely and what that could look like over stages, just as things progress. The diocese has told us that in order to reopen, St. Louis County needs to have at least a 14-day period of flattened new cases. And we're not close to that yet. And with the reopening happening in the county starting tomorrow, it'll be interesting to see when we get to June 1st, what the rate of new cases is every day. So that's one factor we have out there outside of our control. But we're going to work for that day when all systems are go for us to be able to open, what that needs to look like. And I would just say, if there are folks on the call who know of parishioners who do not have a way to connect virtually. They don't have a computer or a phone. And I know of a few, but if you could let me know who those folks are, we're trying to make special efforts to stay connected to them through cards, letters, phone calls. I'd appreciate that.
And Kelly, on that line, I was sort of serious about a geek guild, you know, because I'm one of those IT people. It might be possible to lend easy to use laptops or something to those folks too, if it's a matter of not having a computer. I know I probably have 2 extra laptops here at home that could be refurbished.
You know what though, Jane?
Repurposed.
Take it from an older person who lives alone. It isn't just, do you have the equipment? Frequently it's something very simple, but you know, no means of figuring it out yourself. So by providing people with laptops is not going to solve the problem.
Somebody had mentioned somebody didn't even have a laptop. I was just addressing that. But I agree that maybe a geek guild could also be, we could have volunteers who, so Nikki, when you want to watch the service, you call me and I step you through that service. And there's even screen sharing software that if you give me permission to get onto your computer, if you have internet, I can walk you through and show you how to do things. So
you're a sweetheart. I have grandchildren and children who help me. I am very lucky. Thank you.
Laura and Don have Brody. I think Brody signed us out of the choir rehearsal on Thursday. So, you know, they got a kid or 2, or 3.
And also, I have walked a number of folks through how to get access to things, and Jacqueline has as well, I think. So if you know anybody who's having trouble, they just need to pick up the phone and call one of us, because I was up at 9 o'clock trying to help someone walking through the technology. So we don't mind doing it. You just got to pick up the phone. The other thing that I think is important to say is that when we do gather, there are going to be guidelines, and we are going to have to follow those. So even if I don't feel comfortable wearing a mask, if I'm going to partake in community gatherings at the parish, it's going to be really important that we abide by that. And because, it would be really sticky for me to look at someone and go, why aren't you wearing your mask? You can't come to the church. So, there is going to be this bit of, we're in this together. And even if I think this is ridiculous, I still need to wear my mask because I'm in a community of people.
We've spent a lot of time talking about just the services and that part of our church program. Will part of the committee's job be to talk about how our internal committees function and how that process happens? And also, what about our community outreach? I know we've sent some checks, but I do worry about these agencies that we've had connections to and don't feel particularly, aware of what their needs are, if there's any way we could connect with them. And I hope that's part of the discussion.
Dudley, the committee's really focused on opening for worship and also opening the building otherwise, not so much the functioning of committees and things right now. I know that the outreach committee has been meeting, but Rob, do you want to say more about how church is functioning while we're all at home?
Well, I think some of the activities have been going on. Obviously, anything that, like an AA group or some of the groups that meet at St. Peter's, they have not been meeting, but I know the search committee, for example, has been meeting extensively, and all sorts of activities that they're involved in, they're continuing to do. Kelly mentioned the outreach, and Dudley, I do also share your concern. It's probably one of my biggest concerns is the people in our society who are dependent on not only St. Peter's, but other places within the church community at large, for example, for their daily needs, and how they've been impacted, and have they become the forgotten people. And so that is a big concern. I think what I'm looking for in terms of the committee's work, and it really is, I think, very much a sense of phases. What can we do? And I want it to be really data driven in the sense of what's the public health conditions going on. It makes no sense to me that if the infection rate is increasing, that we should be gathering at all. I mean, that just makes no sense to me at all in terms of being a responsible human being. And it's not just that I will get, I'm protecting myself. And I think this is where I would say I do have some concern in our society, people running around not wearing a mask. And say, well, you know, I'm not concerned, I'm young, I'm not going to get infected. Well, if I get infected, it's not going to be that serious. And that may actually be true. And the vast majority of people who get infected do actually survive. But over 80,000 Americans have died. And a young person may be healthy and get infected and infect 3 or 4 other people, and they may survive. But one of the people they infect may not. And so a big part of, for me, wearing a mask, and to Joseph's point, you know, when we get together, at least initially, we'll be wearing masks. And that's not just for my benefit, the mask wearer's benefit, that's for the benefit of the whole community. It's a way of expressing our caring and concern for others. And so that's, but I think what I'm looking for is to be able to have some sane, safe, graduated phases in which we can begin to re-engage the in-person activities that we've had to severely limit. And I think some of those will contain things like some of the food programs, the putting together of bags, some of the lunch and meals that go on, that have gone on, and reconnecting with some of those organizations. So
I know that all the things you said are accurate. I just thought, well, maybe, you know, if Kelly's committee is dealing with the internal things, maybe either Liza's committee or some other people could sit down and talk about how we could, one, find out what some of these other groups need. And if there is some way, I read in the paper all the time about people responding to needs. So people are figuring out ways to do this. And maybe, you know, Hal's got some idea of other diocesan groups that have done stuff. And I talked to somebody at St. Michael's, and there was one thing that they were doing, but maybe there's some way to look, you know, one thing, for instance, a family could, given the right procedures, could make sandwiches for the, you know, that kind of thing. That's not an answer, but I was thinking there was a way we could deal with that, not wait so long, because our community really needs us.
Can I speak up a second?
Yeah.
I just sent everybody a chat. Recognize that, you know, we've been doing our first of the month grocery bags for Trinity Food Ministry, and account for really about 75% of what they collect. We obviously can't do that now, but I just put in the chat the link to Trinity, where you can follow that and donate funds to help support their ongoing needs. Obviously, you can't be with goods, but dollars work very well for them right now to get the food that they need for their ministries.
And in Jacqueline's newsletter from The Rock, she lists the 5 charities that we're giving for the COVID crisis that you can also give to. And then we should have Liza write an article about outreach for the newsletter. I think that's a good idea.
Also, Jacqueline just posted it in the chat, links to other outreach offerings, the donation for outreach during Easter. There's a link there as well.
And I think that that's really what the need is right now, is for financial donations. That the money that these groups get, that they have the best, most effective, efficient ways than to get resources to stretch that dollar the farthest that it can, to provide food and toilet paper and essentials for people.
Dudley, I think what's really important is communication, because I contacted Carol Clarkson at Sunshine Ministries. That's where all our sandwiches go, the children make once a month. And I bought the supplies and gave them to her in March, but she said in April that they really didn't need anything. She said there were so many organizations that had stepped up, like Schnucks is giving them a huge amount of food, so they were doing fine. And we've just left it, but I'm going to call her again in a week and see what they need. So I think they're good stories like that, but I think it's important to stay in touch with these organizations and find out how we can help.
So to answer the other part of, I think what was being asked was, how's the church running during this time? And so we can tell you that young adults are still gathering for happy hours and Bible studies. The choir still gathers virtually, I believe. The Women's Guild is meeting virtually, it sounds like. We're going to be doing a VBS virtually. And we're also every Wednesday, the little ones can have lunch with Mrs. Babington and myself. There's every morning, Monday through Friday, there's a morning prayer that you can get on. You could either choose to watch it on Facebook Live or actually hop on the call. Kelly is trouncing around the city, doing all kinds of cool meditations. So your parish is still thriving, and we have staff meetings regularly. Our lay staff gathers almost every day, I think, for some sort of administrative meeting. So we're still up and going.
Joseph, to your point, I just want to comment with everybody here to thank all of you for keeping us going and keeping our community together. And Rob, to your point, the extra work associated with these services, we need you and we appreciate everything you're doing. So thank you so much.
Well, I want to, Francis?
Yes, here I am.
Yep. Did you want to say something?
No, but there's so much I want to say. I'm so grateful for everything that's being done. Your message that I receive every day, the Easter message, is wonderful and is a way that I connect. And I also know that we have morning prayer every day. So I do think that if the parishioners can get that information about all the things that are being done, and I feel that a lot of them are, I think we are okay.
Well, and then I would actually say that I think, by and large, the vast majority of St. Peter's community does know what is going on, or they have at least, I mean, over, I think the highest number I saw this morning was like 55 tuned into this Zoom call, which, and given that a whole bunch of people are or there are couples on the call, it's even higher than that. So that people are connected, and it's kind of classic church, because there are some people who are sort of on the fringe, and then there are some people who are very deeply involved, and people's sort of level of involvement is all stretched in between that. So I think the message is getting out. And I think part of it, what is also happening is, it's kind of weird when you're on your own, sort of in your own home, and you get the email and you think, well, this is kind of cool or whatever. And it's like, I wish other people were getting it. And the fact is, I think they are. And actually, you know, it was kind of really heartwarming. I know one of the people was getting the email that I sent out, and she's been sharing them with a friend back on the East Coast, and they've been having some pretty deep conversations around those emails. So that what this whole thing has actually created new capacities in a way for us to share and engage with the world that I don't think we've been aware of. And so I think, you know, clearly communication is really important, and discovering, in a sense, what has been working, what we can do more of.
I mean, I think a great example is, so I'm looking at our Facebook, and morning prayer on Friday had 91 people view it. I'm looking at Kelly's one of Kelly's last virtual post. You know, there's something like 80 people, you know, looked at it, engaged with it. So, it's been quite interesting to see that you have been doing evangelism. And so we really, this technology has opened up some really good stuff for us. And it sometimes feels like we're dumping stuff into a black hole, but it actually is, it's getting traction. So it's not really so much that there's always in the church world people who are connected and people who aren't. But the vast majority of us are able to connect. And the other thing is, you know, sometimes folks, you know, with our caring circles, folks are making phone calls, and some folks just don't want to talk. So, you know, we are reaching out, but folks aren't necessarily reaching back. So, you know, that's a reality too that I think needs to be stated.
But we have written letters.
Yes.
And I think those have been appreciated.
Mm-hmm.
Even though they don't want to talk.
Rob, how about a quick advertisement before we wrap up, that I hope everybody will come back to coffee hour next week. We do this every Sunday, but most especially if you would come back on May 31st, where it will be coffee with our bishop-elect, the Reverend Dion Johnson. He's going to celebrate Pentecost with us. He will be leading worship and preaching, and then he will be in Children's Chapel and will hang out with us for coffee afterwards. So it would be a great opportunity to meet him, to ask him questions about how his move to Missouri has been in the midst of all of this. And his consecration is scheduled for, rescheduled for early June. So please come and meet him.
And that will be a virtual liturgy too, by the way. I think they are we are planning to send every Episcopalian in the diocese will receive a bulletin for the bishop's consecration. That service will be streamed, and we're cutting it up so that no good deed goes unpunished. St. Peter's is doing this so well that the diocese is tapping our shoulders to say, help us put this together. So it will be a virtual liturgy, and you can pop on and watch it, and you should get something in the mail from the diocese so that you can follow along.
Is it June 11th, Joseph?
It's the 13th, I believe.
13th, okay.
Rob, this is Jeff again. Realistically, quickly, I just wanted to say, computer church is our only tool. We're likely going to have a double hump reoccurrence, a reinfection at a high rate, because all the yahoos are going to go around and socialize without masks and cough and spread the germs again. The other thing real quick I wanted to say was masks protect you from infecting others and killing other people's, but they do nothing for inhaling airborne particles. The coronavirus is 300 nanometers in size, which is tiny, tiny. It just floats through your mask. The people that have N95 masks put a face shield up so that the vectoring particle, it's floating in the air, but the plastic shield stops 99%, but there's still one that drifts around your plastic shield. But on inhaling, a mask does absolutely nothing. Your best defense is being 6 feet apart. Whether you have a mask on or not, staying 6 feet apart is the healthiest thing to do, and not touching surfaces. And I'm not a germophobic. I'm just saying that wearing a mask is like stopping at a red light. If we didn't stop at red lights, we'd kill each other. If we don't wear a mask and we're a silent, infectious person, we're going to kill somebody's child or grandparent. But they do absolutely nothing to protect you from inhaling a virus particle that's 300 nanometers.
It can also come in through your eyes. You need to wear
Well,
glasses.
and I think that's the whole point of having some safe, sane, and scientifically informed processes in place. I do want to make one other announcement, as just to acknowledge the time and that people will, is that this Thursday is Ascension Day, and the Ascension is actually a huge part of my own personal spirituality, and I could not go an Ascension Day without having an Ascension Day service, and I realize most churches, in the Episcopal Church at least, don't have an Ascension Day service. So, but we are. This Thursday, it'll be available at noon, and we will have a service to celebrate the Ascension, which, just in a nutshell, it is the conclusion of this incredible story of how God came to earth and lived as one of us. But then in the Ascension, our humanity has been taken back into the heart of God. And all this idea that humans and divinity are somehow can't be together is just a total bunch of nonsense. And so that we will be celebrating this incredible reality that we are one with God and God is one with us. So that's what we'll be doing Thursday. We'll be sort of doing another version of it on Sunday, Sunday after Ascension, but it'll be available noon on Thursday, like the Sunday services are. I want to thank you all for participating this morning and being online. We will be continuing to communicate with you in terms of the plans to reopen. And if you do have thoughts or reflections, please email one of the staff as we develop plans. It's not that we won't be, but in terms of how we will be re-entering and re-engaging with the world in a safe and sane and spiritual way. Have a great week, folks.
God loves you. Bye.